Welcome to Domopalooza. I'm so excited to spend time with you guys today. One of my favorite things, well, first of all, Domopalooza is the only place where you'll ever catch me anywhere on the planet in a light blue jacket and very expensive kicks with light blue sole. One of my favorite things about Domo is not only the employees, but the customers. And I get to spend time with some amazing customers. Shout out to my friends from Target who are in the audience, a bunch of other folks that I've had an opportunity to meet with. It really is a treat for me to introduce you to a pioneer in using Domo and solving some pretty incredible problems. He's the CEO of Regional One Health out of Memphis. It's a pretty important hospital. They're a Trauma One center. They handle burn victims, really, really complicated OB/GYN problems, and they really take care of so many people. So what a treat to introduce you to, gosh, I'm so nervous, Dr. Reginald Coopwood, who's fantastic. So please come out and join us. Great. Please have a seat. So before we get started, you're kind of a big deal.
Oh.
You won a really big award last night. So Domo has an Ovation Award, and you were the Executive of the Year, right?
I was.
Congratulations.
Honored to be. Thank you. Thank you very much.
Because there's a lot of executives on the planet, but the Executive of the Year? So we got to spend a lot of time together. Why don't you tell my friends here a little bit about you and about what you've built at Regional One?
Well, I'm Dr. Reginald Coopwood has stated I'm what I call a recovering surgeon. It's been 20 years since I've asked for a scalpel, so it's a long recovery process. But I've had the opportunity and the pleasure of being CEO at Regional One Health for the past 14 years. We are, as you stated, Level 1 Trauma Center. We cover West Tennessee, Eastern Arkansas, Northern Mississippi, and we provide trauma care, burn care, high-risk obstetrics, and we have a very large NICU. So it's a big job. It's a hospital that this community and region depends on, and it's been an honor to be its leader for this period of time.
So you're not just the leader, but you actually tripped across Domo on a LinkedIn post like 7 or 8 years ago. So tell me about that.
So, I have kids that do what is now X and all this other stuff, and I went on LinkedIn, so I thought I was connected with social media, and I was just kind of flipping through LinkedIn, and one day a advertisement for this company called Domo came across where they were talking about, I think it was a trucking firm, where they were drawing how each truck in different routes across the country could get data back to the central organization, and I said, I wonder if that is applicable to healthcare, because we have a lot of disparate systems. We have single-use systems and HR single-use systems here and there. They don't naturally talk to each other, so it's difficult to get data out of each one of those systems to make sense. So I invited our technology officer at the time. I said, well, why don't we bring Domo in to see if they can help us? And so they came. For some reason, I wasn't at the meeting. And a week or so later, I said, has Domo come yet? They said, yeah, they came, and our CFO asked them, what's your healthcare experience? And they said, none. And they said, oh, we don't have any, we need companies to have healthcare experience. And so I said, no, bring them back.
So you schooled them. You're like, are you joking me?
Right. I said, bring them back. This isn't about healthcare experience. It's about connecting disparate data systems to make decisions and to be able to visualize data in a way people can use it. So our CFO said, well, we got data. Got reams and reams of spreadsheets and numbers. And I said, well, how about we make it so people can see it, understand it, and be actionable about it?
So you fixed it.
Well,
It's okay. Yes, say it.
I brought Domo in, and then I hired smart people to leverage the technology in order to be able to make it work for the organization.
But what's so cool to me is that you're a surgeon by trade. Like, you were a surgeon for 20 years, you operated. And as a surgeon, you have to take the data that you have and you have to make critical decisions all the time. So do you think that because that was your training, and when you saw it on LinkedIn, you're like, okay, I can use this to actually solve a ton of problems. Do you think that helped you in trying to figure out, like, how can I build this system that's different?
Absolutely, because there's so much data in healthcare, your lab results, your vital signs, and all these things that are in singular silos. And as a surgeon in an operating room, we're always monitoring blood pressure, and we're always monitoring all the physical signs of the patient and the data that I ascertain by looking at the organs that might be diseased. And we make decisions based on the information that we had, the history that's within our brains about what we've seen before. And it's an important part, because if you don't want a surgeon that just kind of wings it. So you want a surgeon that is able to take all the information they did in their training and their experience to be able to make the right decision at the right time. And so this is what I said, how about now that I'm leading an organization that is full of surgeons and medical doctors and anesthesiologists, how about if we give them more data on how to better practice, to affect better quality outcomes, and how about we give them more data to be able to be more efficient in their practice? And that's what the journey, when it started, that's what the journey was about, was to be able to help people. As physicians, we call ourselves data scientists. And the first thing we always say, if you talk to any healthcare leader, is the doctors, I don't believe the data. You know, the data is not true. And we said, how about if we bring in their data sets that they trust, and then they're able to be a part of it. Now we have physicians now wanting a dashboard for this and a dashboard for that. And what we wanted to do, we started on this Domo journey, is to create the thirst, for people to be thirsty for more information. And today we have over 200 dashboards that people look at every day. And you know, the best way you know how it's being utilized, let the data not flow for some reason, the dashboard's not populated, phones start
and they're
ringing.
Beating your door.
Where's our Domo dashboard? We can't see it. And there we
Don't
know.
give me no patience until I get that data.
There we know that we've done something good.
Yeah, and I think what you built is pretty impressive. So if you have time, you got to peek at it, because the fact that you brought it into an organization that hasn't been disrupted, healthcare hasn't been disrupted for a very long time, and you're brave enough to not only have people trust you to do this, but now because of your hospital, it really does save lives. It really does matter. So you and I were talking about disruption. I gave you my own opinion about some of the disruptions in healthcare. Don't ever give me the clipboard again when I come to your office. What do you see for the next 5 to 10 years in healthcare that has to happen? And you really are pushing this change. So I want to hear what you think about that.
Well, it's a difficult question to answer, because as I told you, 18 months ago, no one was really talking about AI until the whole ChatGPT thing. I mean, there are people talking about it, but not publicly. And here, 18 months later, it's on everyone's agenda. It's top of the mind of everybody. It's being built into everything we do. And so you asked about 5 years. I think the exponential growth in how data is used and how AI can help leverage data. I can look at 10 patients and look at their charts, but I don't have the capability of looking at all the nuances of each one of these cases and say, here's some similarities, and maybe if we had made this intervention at this time, we would have had a different outcome at this time. And so with something like a Domo platform, with AI to be able to look through the data and to be able to help make those decisions, I think it will really transform healthcare from where it is today to where I think it can be.
And it has to change.
It has to. It has to. And we don't like change in healthcare, by the way, in case you hadn't noticed.
But we're like born to die, so let's just not die sooner, right? Let's work really hard to not die sooner. So one of the things that I love about what you built, and you can tell that it was built by a doctor, is that you've built this organization called Regional One Health Solutions. And the reason you could tell it was built by a doctor is because you're actually sharing. So why don't you tell us about that program?
Well, when we started on our Domo journey, it was kind of hit or miss. We were kind of pushing people to turn on and look at it. We were kind of monitoring how many people, we bought all these licenses. That was the model at that time, and so we were looking where people weren't accessing the data. But then as we created that thirst, and more people got involved, more people needed the data, and were utilizing the Domo platform. We built over 200 dashboards over this period of time, and we really looked at, one of the big things that we looked at was length of stay. And in hospitals, length of stay is important in that getting the patient through the health system efficiently. It's not kicking them out of the hospital early, it's discharging them when everything that they need to have accomplished within the hospital has been accomplished. We were running almost 9 days on average, because some of it was because of the complexity of our patients, but some of it was because of inefficiencies. And so when you don't have data, it's easy to blame someone. It was the nurse's fault, the case manager's fault, the doctor's fault, and everyone lived in that environment, and our length of stay never changed. And so as we created this around, we've created about 50 metrics with length of stay. We've reduced our length of stay by almost a day and a half, almost 2 days over this period of this journey. And it's because of the data that people have. It's because data that we didn't have access to, now they're seeing. And I text my CFO, I said, what is the value of reducing by 1 day? He said, we can do over 12,000 more admissions in a year by a 1 day reduction in length of stay. And it's a huge success that we've done. Everybody is involved, from nursing to the physicians to case managers. And so we said, how do we leverage this and offer it to the wider healthcare community? So we spun off a company called Regional One Health Solutions, and we're looking to go across the country and introduce it to healthcare. And hopefully they'll see the value and the excitement. And maybe one day we'll be a tech company that also does healthcare and trauma.
Right, yeah. I would invest in that, by the way. I love that you're sharing what you've learned, because healthcare, it has to be disruptive. People like me, my friends in the audience, we need it to be better for our kids. We need it to be better. And that's why I love that a doctor's leading it. So my friends here are going to have access to a ton of information. You're probably going to get mobbed when you come off stage. Kind of be a big deal now. What's the one thing you want them to leave with? Because they've already heard from Darren and their brains broke, but there's so much going on. So what's the one thing that you need them to hear from you, so that's the one thing they're going to carry away today?
I really think that as we look at, and healthcare is a prime example of an industry that needs disruption. We're happy with the status quo. That's how we did it. We were forced to get an electronic medical record. We got the electronic medical record, but we don't use the data behind it. I think the opportunity to leverage the data that's out there, not only in healthcare, but in other industries, whether it's the fintech industry or wherever else, there's opportunities to present data in such a way that becomes transformative for those organizations to be more efficient, to be more profitable, have better outcomes. And for us, it's about our patients. Having more information about our patients helps us treat them better, have better outcomes, and be more productive in society. Embrace it, change it, and maybe one day, you can come out here with smoke. Did they have smoke machine come out here when we came out? That was pretty impressive.
I told you you're a big deal. So, Dr. Coopwood, thank you so much for spending a little time with us today. One of the things that Dr. Coopwood told me in the back, when we were backstage, he's like, I'm kind of a closet entrepreneur. And I kind of schooled him a little bit and said, actually, sir, you're actually an entrepreneur, because you're taking problems and you're looking for solutions and you're open to the universe of possibilities. So please join me in thanking my friend, Dr. Reginald Coopwood.